Hello, and welcome to the third TUH University Hospital podcast series of Let's Talk About. In this series, we are going to talk about Down syndrome. You will find this and our previous series on the hospital YouTube channel, Facebook page, Apple Podcasts, and Podbean. Each episode is targeted at individuals with Down syndrome, their families and carers, health and social care staff, and anybody who has an interest in the health needs of adults with Down syndrome in Ireland. We will speak with experts from Down Syndrome Ireland, Children's Health Ireland, the Intellectual Disability Supplement to the Irish Longitudinal Study on Ageing, known as IDS TILDA, and our own expert speakers in intellectual disability and the National Intellectual Disability Memory Service in TUH University Hospital. My name is Geraldine Kyle, and I'm a registered nurse tutor at TUH University Hospital and a mother of a young adult with Down syndrome. In this fifth and final episode of the Let's Talk About Down Syndrome podcast series, I'm delighted to welcome Professor Mary McCarron. Hello, Mary.
Hello, Geraldine.
Mary is Professor of Ageing and Intellectual Disability, Director of the Trinity Centre for Ageing and Intellectual Disability, and Executive Director of the National Intellectual Disability Memory Service. She is the founder and principal investigator for IDS TILDA, the Longitudinal Comparative Study on Ageing in persons with intellectual disability, including persons with Down syndrome. She has also led a longitudinal cohort study of dementia in people with Down syndrome spanning over 25 years, which has led to the development of Ireland's first dedicated national memory service for people with an intellectual disability, where she serves as executive director. If you would like to know more about the important work done by the National Intellectual Disability Memory Service, please listen back to episode 4, where we spoke to Sean and Evelyn about the service. Mary, we heard about the IDS TILDA study when we spoke to Sean and Evelyn in episode 4. Can you tell us how the study evolved?
Yes, well, when Ireland was launching TILDA, which is the General Study on Ageing, I was very surprised that people with intellectual disability were not going to be included in this study, despite the fact that we had shown that people with intellectual disability were dying about 20 years earlier than the general population. So I was very committed at the time to ensure that we had people with intellectual disability included within this general study on ageing. So we were very lucky. We are the first country in the world to ever have included people with intellectual disability in a longitudinal comparative study on ageing. So now we have really good data on how people with Down syndrome age, the determinants, those factors which influence their health and their well-being as they age. So we're in a good position in Ireland now because we have good data to help us understand those issues.
It's very interesting to hear about how those inequalities weren't recognised initially. It's wonderful that there's work looking to do that now. And based on the findings of IDS TILDA so far, what would you say would be the key messages for people with Down syndrome to maintain their health?
Well, I think we are now at wave 5. We have 15 years running now, and we just published a wave 5 report in 2023. And I think one of the positive things that I want to start off with, that people with Down syndrome now are living much more enriched lives than previously. They're now part of their communities, they're in ordinary schools, they're now in employment, they're much more active and much more engaged. So this is positive. And we also see, in comparison, we are actually able to look at what life and health and well-being was like for people 15 years ago versus now. So we're able to look at what we call intergenerational differences. And what we see is that, yes, people are living healthier lives. But we also see that there's some very concerning issues when it comes to health and well-being, and particularly for people with Down syndrome. So we know that people with Down syndrome age differently, that they're much more at risk of developing what we would call earlier onset of many chronic disease issues. So even from young adulthood, we know that we have issues like sensory impairments, like problems with eyesight, problems with hearing. We also know that people are more at risk of other conditions, such as underactive thyroid gland or things like hypothyroidism. And all of these things can be treated. So it's really important that we understand that they're more at risk. So when they go to the GP, that they're screened for those issues. We also understand that they're more at risk of things like poor bone health. Many of them have issues perhaps around mobility. So we need to be screening for things like osteoporosis, osteopenia, and moving in with preventative measures much earlier on. So there's certainly some of the issues that we are seeing. And also, as well as the physical health, what we call physical health determinants. Of course, we know that our health is also hugely determined and influenced by what we call the social determinants. You know, how our friends, our presence in the community, our opportunities for education, our opportunities for employment. And these are all really important prerequisites for good health as we get older. So yes, we need to look at those physical health issues, but we also need to look at those other social factors, which for me and you, as we know, are just so important. Combating loneliness. These are really important issues. And people with intellectual disability, and particularly those with Down syndrome, often need more assistance with these issues. They need assistance often in creating these networks around them. And one of the big differences, of course, that we have seen is that this population now, this current generation of people with Down syndrome, and probably and hopefully it will change over time, they're not married. They don't have children, so they don't have those important critical social networks that is so common perhaps in the rest of society. So these are, I think, some of the key differences that we found.
That's very interesting. I think I read in some of your study results that a lot of the people that participated in your study go to day centres or day services for people with intellectual disability. Is that correct, Mary?
Yes, indeed. And we know that there has been government changes and policy changes in terms of new directions, which is now the roadmap as to how day services will be provided. So rather than previously, historically, people would have went to larger centres and engaged there in often quite rudimentary type tasks, whereas now we're much more developing what we call community hubs, so that people now are engaged in the community in smaller groups and working there. But I think now for young adults with Down syndrome, and I know that we have had other policy initiatives in terms of access to education, and particularly when they finish the second cycle of education, secondary school, very often there was huge issues in people entering third level education. And this was also unequal in terms of their ability to access. And I'm really pleased now to see that there has been an investment to ensure that we address this inequity, and that no more than all other children who finish the secondary school cycle, that they also can look forward to also going in and achieving the experience of entering third level education and being students within our universities and technological universities going forward. So I think these are all really important issues.
Absolutely. And do you think if there was a healthcare staff member, whether they're working in the acute hospital sector, like Tala University Hospital, or in a day service, what would you encourage them to do in terms of accessing the findings of IDS tilde and bringing it back to their service? Are there key messages that they can access from your website, or where should they try to find out more and engage more?
Yeah, well, one of the important issues for us is that this data reaches the people that need it, and that is people with intellectual disability themselves and their caregivers, their family caregivers or staff caregivers. So we would have worked very closely with people with intellectual disability themselves in terms of the development of easy read reports. While we have the nice big scientific report, it's really important that we had an easy read version, and this is available from the TCID website, and people can download that from there. And it is really important. They're done in chapters, written in conjunction with people with an intellectual disability and with Down syndrome themselves. And Mélanie Yap, who's employed within the Trinity Centre for Ageing and Intellectual Disability, she has her own, chairs her own PPI panel, and they were fundamental in terms of the type of the report, the tone of the report, and ensuring that this report was accessible to everybody, regardless of your level of ability. Okay. So I really would encourage people to look at that. And I think as well, in this particular wave, we had a very important spotlight on the health of women and the health of women with Down syndrome. And I think that was really interesting. We do know that we have a women's health strategy, but there's very little mention or no mention of women with Down syndrome or intellectual disability within the strategy. But nonetheless, that we found that women with Down syndrome were in much poorer health than men with Down syndrome. They had much higher levels of obesity. Women overall with intellectual disability had higher levels of mental health problems, anxiety, of depression, of poor bone health. And we were really astounded by the unpreparedness of women to understand and address issues involved in the menopause. Many women had almost 80% of women said that they received no easy read information in terms of menopausal health or what that meant for them. So many of them had no understanding of what was happening to their bodies at this very important time in their lives. Many of them felt that they weren't able to understand the symptoms, and many of them didn't report symptoms. And it's not that I feel for a minute that they didn't have symptoms. I actually feel it was probably to do with their inability to recognise and be able to report. And then I think it's really important that we understand that there are different levels of intellectual disability. So there's people who are perhaps within the very mild range, people who have much more learning needs within the more severe level or profound level of intellectual disability. So healthcare professionals need to be prepared and trained to understand how you communicate with people who have these varying and different levels of ability. So I think that is really important, because many people may not be able to self-report at all. So how do we understand? How do we explain to somebody what that healthcare consultation was about? How do we, when they come to a hospital like Tala University Hospital, ensure that this is a good experience? And when we were setting up the National Memory Clinic, we worked very closely with people with intellectual disability to try to ascertain from them what they wanted from this clinic, what they wanted the environment to look like. And we know that many people with intellectual disability have a big fear of going into a clinic or a hospital type setting. So how can we make that experience better? What can we change within the environment that would make it better? How can we help the staff who are going to meet this individual to have a better consultation and prepared to engage in that consultation? So I think we have done great work in trying to address some of these issues, but we have a long road to go in terms of how we work with the hospital system to make this better. And certainly in the National Memory Clinic, and Sean and Evelyn will have spoke about that, we placed a lot of emphasis on the welcome, the environment, what it feels like, and to make sure that people had a good experience and it wouldn't be stressful if they needed to come back.
No, thank you very much. It's a theme that has come up again and again about the importance of good communication and ensuring that information is tailored to the audience. And that might mean presenting it in many, many different ways. And you've summed that up really beautifully, Mary. Thank you so much. Before we wrap up today, was there anything further that you thought was important to be raised in our conversation today?
Well, I think, we have very good services, or good, and definitely develop good services for children with Down syndrome. And when they come to 18 years of age and they move into the adult system, I have great concern as to what happens to them and their families at that stage. And oftentimes the health system is really unprepared. It's like falling off the edge of a cliff for many of them at that stage. So we really need to understand, what that transition from children's services to adult services, and how we prepare adult services to meet now and to understand the different healthcare needs of this population. And then, of course, as we move out to adult services, because people are aging differently, and people with Down syndrome are looking at people, presenting with symptoms of dementia, perhaps in their 40s and early 50s. How we ensure that services are just not continuously built on chronological age versus need. And I think that is the big issue for me, is that we need to move from using chronological age, because that will mean that many people, particularly those with Down syndrome, will not meet the age criteria to access the healthcare needs that they have.
Well, Mary, I hope very much that this important work will see a future where we're starting to meet all of those aims and more. And I would like to thank you very much for your contribution today. Thank you so much to our contributor, Mary, this week. This was the 5th and final episode of our Let's Talk About Down Syndrome podcast series. Thank you for listening. In episode 1, we spoke with Nicola and Ross. We heard valuable insights from the lived experience of an individual with Down syndrome, and we discussed important communication strategies that health and social care staff should know. In episode 2, we spoke with Fiona. We learned about the common health needs of adults with Down syndrome and discussed the importance of a smooth transition from children's to adult health services. In episode 3, we met Suzanne and Fran. We learned about the HSE Health Passport and good practice advice for healthcare staff working in the acute hospital setting. In episode 4, we met Sean and Evelyn. They spoke about the issue of dementia prevalence in individuals with Down syndrome and explained how their memory service is supporting the needs of individuals with an intellectual disability affected by dementia. In this 5th and final episode, we learned about the IDS-TILDA study and how the longitudinal dementia study in individuals with Down syndrome led to the development of the National Intellectual Disability Memory Service. We discussed many resources during the course of the podcast that you might wish to access. We have set up a link on the Tallaght University Hospital website where you can read and learn more. We would like to acknowledge all the contributors to this series for sharing their expertise and know-how. A huge thanks to you all. We would also like to thank Shauna Ennis, Head of Learning and Development, and Elizabeth Fox, Adult Education Officer in Down Syndrome Ireland, for conceiving this 3rd podcast series. Joanne Coffey, our communications expert who guided and advised every step of the way. Kevin O'Farrell for his production and editing expertise, and to you, the listener, for joining us. Wherever you found us, please feel free to share the series. I hope we can talk again soon in our Let's Talk About podcast series.